Thanks,
Minister. Minister, I want to raise the issue of long COVID with you. Now, during the summer, there was an academic report, review article published on long COVID in terms of the science, research and policy, and made quite a number of recommendations in relation to it, some of which are applicable to your own department. And I think it was published in Nature Medicine, and what it's talking about is taking a more adaptive and flexible approach to support long COVID patients so that they can come back into the workforce.
Deputy Minister, please.
And thank you, Deputy, for raising this issue. At the onset of the pandemic, the Government acted early and without hesitation to support all workers who contracted COVID-19. Workers outside the public service sector could avail of an enhanced illness benefit payment, and eligibility criteria were set to include the largest cohort of workers possible, including the self-employed. The scheme paid some 578,000 claims at a cost of over €350 million. The temporary scheme of paid leave for public health service employees was introduced in relation to employees in the health services who had not recovered from a COVID-19 infection. This temporary scheme is a matter for the Minister for Public Expenditure, National Development Plan Delivery and Reform, and has been extended by that Minister a number of times, most recently to June 2025. My department continues to provide a suite of income supports to those who cannot work due to illness or disability. These supports are available to people with COVID-19 and long COVID. Eligibility for these payments is generally not dependent on the type of illness or the disability, but on the extent to which a particular illness or disability impairs or restricts a person's capacity to work. Illness benefit is the primary income support provided by my department to those who cannot work in the short term due to illness of any kind. Eligibility for illness benefit depends on the person's PRSI record and class, and only contributions made under classes A, E, H or P count towards this payment. The two main long-term disability income supports payments provided by my department are invalidity pension and disability allowance. Invalidity pension is a social insurance weekly payment paid from the Social Insurance Fund. Eligibility is based on PRSI contributions and medical condition. Disability allowance is a weekly allowance paid to people with a specified disability who are aged 16 or over and under the age of 66. People who are ill but do not qualify for other illness or disability schemes may apply for means-tested supports through the Supplementary Welfare Allowance Scheme to help meet essential expenditure which a person could not reasonably be expected to meet out of their weekly income. This includes certain supplements to assist with ongoing or reoccurring costs that cannot be met from a person's own resources.
Deputy Naughten.
Minister, this publication last August in Nature Medicine by Dr. Al Ali and his team, he works in Washington University and with veterans in the US, and they've looked at studies all over the globe on long COVID and have made the point that the recovery rates are extremely low after 1 year. Now, I do know that the medical officers within your own department based in Longford have been taking a flexible approach in relation to patients with long COVID symptoms, and I want to acknowledge them in relation to that. But based on poll research that I've carried out, Minister, and sadly it's the only evidence that we have in this country, we're still waiting for the HSE to come out with the prevalence figures, but we could have, based on the poll figures that Ireland Thinks produced on my behalf, 2.2% of adults in this country could have the symptoms of long COVID, and these extending way beyond 12 months.
Thank you, Deputy.
We do need to have a coordinated strategy.
Minister, please.
Thank you, Cancora. Deputy, well actually I haven't seen the report you're referring to, but I do know that you, Deputy, you've done a great deal of work representing people with long COVID, and I know you've highlighted the issue on many occasions. And I too have met people in my own constituency office and they tell me they still feel the effects of COVID. They're not able to do the same things physically and that they could do before they had it. We have a number of existing schemes that people can avail of, whether it's illness benefit or disability allowance. And maybe for some people, they are able to work, but due to their condition, they're not fit to work as much as they could before. And I would encourage them to apply for the partial capacity benefit. That's available to anybody whose capacity to work is reduced due to a medical condition, and there are different levels of payment depending on the severity of your condition. So along with illness benefit and disability allowance, that's another option for people if they're able, to do some amount of work.
Minister, and coming back to this report again, two of the points that were made in it. One was that there needs to be streamlining of disability benefit processes. Now, I accept that the schemes are there within your own department here in Ireland, but I think having it very clearly defined on the department website, if you have the symptoms of long COVID, if they're ongoing for a period of time, these are the options that are available to you, rather than people having to piece them together individually. That's the issue that I want to bring to your attention. The other point, Minister, and it's related to your own schemes, and the recommendation in this report was that workplace policies that support individuals with long COVID should include flexible working hours, increased breaks to allow for pacing, and the option for remote work and sick leave policies. So I think you need to lead from the front in relation to this and encourage employers to have that type of flexible approach.
Sir, please.
Thank you, Deputy. And, in fairness to most employers, generally they would try to be flexible, because if you give a little, you usually get far more back. It's always been my attitude to that. Just to say that partial capacity payment is something that maybe we should promote that more. I accept that, and I'll certainly do that. But I suppose, to be fair to social protection, they're very good at telling people what options that are available to them when they do reply to them. But we'll make sure that they're aware of the partial capacity payment that they could look for, because it can be paid for perhaps a longer period of time. I think it might be up to, I'm afraid nearly to say, because in case I've said the wrong thing, but up to 3 years possibly, and I'm open to correction on that one. But I think it's something that, I am actually right, it is up to 3 years. So it's something that maybe they should look at.
Thank you,
So,
Minister. We go to question 8.